Join us now for Health for Life, brought to you by Hamilton Healthcare System. Today we're talking with Dr. Aubrey Cawthon of Hamilton Medical Center. Thank you for joining us in the studio today, Dr. Cawthon.
Glad to be here.
I'm glad you are. Dr. Cawthon is the medical director of Hospitalist Services, the chairman of medicine, and a board-certified internal medicine hospitalist at Hamilton Medical Center in Dalton, Georgia. Dr. Cawthon completed his medical training at the Ross University School of Medicine, his internal medicine internship at Memorial Health University Medical Center in Savannah, Georgia. Dr. Cawthon, how long have you been with Hamilton?
As of August 25th, 5 years.
5 years. That's a long time. Congratulations. That's great. Now, in your spare time, and I know a lot of you doctors don't have a lot of spare time, but when you find spare time, what's some of the things that you enjoy doing?
Well, I will answer this in a pre-COVID
Okay, yeah,
sense.
Pre-COVID, what did you enjoy doing?
I like to go to concerts, go to restaurants, go visit family and friends, hiking, outdoors. I grew up on the lake, Timms Ford Lake up in Middle Tennessee. I'd like to get back to doing that, but since med school, I really haven't been on the water like I used to. So one of these days I'll get back to it.
Well, you mentioned concerts. What's your favorite kind of music? What's your favorite concerts?
I believe what they call it now is Americana. It's more what I would consider real country. Tyler Childers, Sturgill Simpson, that vein, Ryan Bingham.
Yeah, a lot of that Texas sound.
Yeah.
A lot of that Texas sound. That's good. Now, you are a hospitalist. Can you tell us exactly what is a hospitalist?
Long story short, a hospitalist is an internal medicine or family medicine generally who works only in the hospital. It's kind of a shift from the traditional primary care model where you know them from birth to death and you follow them in the hospital, out of the hospital. My dad was a physician assistant, so he kind of grew up in that model with traditional. He did everything from hip replacements, gallbladders, C-sections to managing patients and blood pressure and diabetes in the clinic.
Everything.
So with the continual progress in medical knowledge, one of my favorite statistics to quote is in 1950, the medical literature doubled every 50 years. So it took a while for you to double that.
50 years? Yeah.
Now it's every 9 months that it doubles.
Come on, really?
So
wow. So this is a lifelong education.
Absolutely. The day that you determine that you know everything in medicine is the day you need to retire.
That's right. Yes, because there's no
nobody
way.
can know everything.
No.
So that's why you continually get more specialized, and that is part of what hospital medicine is. We are specialized inpatient acute care setting. We don't
at the hospital.
Correct. At the hospital and only at the hospital. The hospital is my office. I don't have an office outside of Hamilton Medical Center.
I understand.
We specialize in treating people who are very sick, trying to prevent them from going into the ICU to where the critical care physicians take over, trying to get them back to their primary care in the outpatient setting.
I was going to say, and this is the role of a hospitalist.
Correct. To manage medical problems in the acute care setting in a hospital.
Wow. Very interesting. Why did you choose to be a hospitalist?
Internal medicine training is about 70% hospital-based. It's more or less what you're more comfortable with. It was really what I've envisioned myself being when I went to medical school, being a doctor in the hospital and treating patients who are very sick and getting them better. To me, it's a good blend of the academic pursuits, because internal medicine is a very cerebral specialty. We're not doing a bunch of procedures. We're kind of taking the skin and its contents and making sure the physiology of it is back to normal. That's kind of the goal.
Very complicated.
Yeah.
And a lot of work and a lot of study, a lot of education.
Right.
A hospitalist. That's new to me. That's great.
Yes, the term hospitalist was coined in 1997 in a paper, I believe in the New England Journal of Medicine, that they kind of said, well, I only work in the hospital, so I'm a hospitalist.
And that's how it took off.
And that's, yeah.
Well, that's very good. That's very interesting. We got a lot to talk about today. We're going to take a quick break. When we come back, we're going to talk about some of the benefits of having a hospitalist care for you while you're at Hamilton Medical Center. We'll be right back.
If you're in need of medical care, don't delay. Your health won't wait. Hamilton Medical Center is ready to care for you. We are following CDC guidelines. Patients and guests are screened for COVID-19 symptoms. Those who are suspected to have the virus are treated in a separate area. Plus, Hamilton's high-powered UV light robots eliminate 99.9% of bacteria and viruses on surfaces. Please do not delay medical care. Your health won't wait. As always, Hamilton is here for you. Join us on a journey to better health. Health for life. Simply put, that is why Hamilton Medical Center is here. From primary care and specialty care practices near you, an accredited chest pain center, a certified joint replacement program, a new children's institute, cancer institute, endoscopy center, and more. Hamilton is here for you and your family. Learn more at hamiltonhealth.com. Hamilton Healthcare System. Health for life.
Welcome back to Health for Life. Today talking with Dr. Aubrey Cawthon. Dr. Cawthon, what are some of the benefits of a hospital having a hospitalist program?
Excellent question. It's a relatively new specialty, so it's kind of a foreign concept to a lot of people. The studies have shown that hospitalists improve quality of care, increase patient comfort, and prevent delays in day-to-day care in the discharge of patients. It's kind of a twofold benefit, not just in the hospital setting itself, but also in your primary care physician's office. They're able to care for you more efficiently and perform the tasks that they need to in the office, not getting interrupted to go to an emergency in the hospital. We're taking care of that emergency. The benefit is we are specialized for that hospital setting, people that are much sicker, and they are able to be more efficient in the office. We're able to be more efficient in the hospital. We navigate the complexities, not just of the medical care, but also social work, case management, making sure that we get physical therapy, occupational therapy, speech therapy when people need it to get them the best chance to recover once they go home.
Wow. If you have a patient come in, a patient who does have a primary care physician, I'm sure you're talking with that physician and you guys are getting together on that patient.
Yes. We have a good group at Hamilton. We really do. I'm proud of the people I work with in the hospitalist department. They all care about making sure people get the best possible medical care they can.
Now, what about a patient who doesn't have a primary care physician? What do you do in that case?
In that case, we always set up somebody with a primary care visit. There are several options. HPG, Hamilton Physician Group, has several primary care offices in not just Whitfield County, but in the surrounding counties as well. So very easy to get in with them. The internal medicine clinic, they're building a practice there. Coming up in July, we'll have a family medicine program that will also need
patients for that, sure.
Correct.
Very interesting. If someone doesn't have a primary care physician, you mentioned that Hamilton can help. Tell us about that.
If you don't have a primary care provider, there are several to choose from at Hamilton Physician Group and Hamilton Internal Medicine Residency Clinic. You can visit hamiltonhealth.com/HPG and hamiltonhealth.com/internal to learn more.
We're going to take a quick break. When we come back, we're going to be talking about how inpatient hospital care has evolved over the years. We'll be right back on Health for Life.
Join us on a journey to better health. Health for life. Simply put, that is why Hamilton Medical Center is here. From primary care and specialty care practices near you, an accredited chest pain center, a certified joint replacement program, a new children's institute, cancer institute, endoscopy center, and more. Hamilton is here for you and your family. Learn more at hamiltonhealth.com. Hamilton Healthcare System. Health for life. If you're in need of medical care, don't delay. Your health won't wait. Hamilton Medical Center is ready to care for you. We are following CDC guidelines. Patients and guests are screened for COVID-19 symptoms. Those who are suspected to have the virus are treated in a separate area. Plus, Hamilton's high-powered UV light robots eliminate 99.9% of bacteria and viruses on surfaces. Please do not delay medical care. Your health won't wait. As always, Hamilton is here for you.
Welcome back to Health for Life. Today talking with Dr. Aubrey Cawthon, Hamilton Medical Center. Welcome back to the show. Dr. Cawthon, from what you've shared with us so far, it sounds like hospital care has changed a lot over the last few years. Would you say that's true?
Without a doubt.
Is that right?
Yeah. As we discussed earlier, I had the unique perspective, my dad being a physician assistant in the 1980s. His license number was 32. So
Is that right?
in the state of Tennessee.
Wow.
Yeah. So he was, on the forefront of that.
Yes.
But as medicine has advanced, medicine has become more and more complex, which is where the specialty of hospital medicine has helped to kind of navigate that complexity. Just this morning, I was reading a study that went through Medicare patients back even back 2010, so only 10 years ago. The number of diagnoses at discharge on average was about 8. Flash forward to 2017, and it was up to 14. So we're learning more, having someone whose job it is to navigate all of that, make sure that the medicines and the treatments that we provide don't cause harm but still make you better. That's what a hospitalist does. That is our job as physicians, to navigate the complexities of healthcare in the present day.
Hospital setting.
Right.
At the hospital.
Correct.
No offices outside the hospital.
Correct.
Hospitalist and just hospital work. Very important.
It's essentially the same thing that your primary care physician does in the outpatient setting. You have a heart problem, they send you to a cardiologist. You have an endocrine problem, they send you to an endocrinologist. Mm-hmm. Same thing happens in the hospital. It's just more acute. It's more emergent. So we have consultants rather than referrals. But it's the same doctors, the same cardiologist you see out in the clinic, you'll see in the hospital. Same gastroenterologist you'll see out in the clinic, you'll see in the hospital. But it's a little more emergent in those cases.
Right. Now, there's a lot of your patients will have families that want to know what's going on. Their loved one is in the hospital, and they're worried about this COVID-19 thing. What are you guys doing as a hospitalist to help patients and families get together in the days of COVID-19?
Excellent question. This obviously is affecting everybody on the planet right now. What we're doing is spending more time on the telephone speaking with family than we used to. We try to make sure when we admit somebody that we have a good primary contact that can disperse information to the entire family.
Now, a lot of folks like face-to-face. The telephone's great, but they like to be able to look at someone face-to-face. And FaceTime, other things like that are very convenient to a lot of people. Is the hospital doing anything to help in that?
Good question, yes. The hospital does have devices that they can, at the patient's request, can bring into the room so that you can FaceTime or have that video face-to-face whenever you need to.
So even if you don't have a telephone that has that function, you guys have some things that people can use.
Correct. You would have to have that function on the outside.
On the other end,
right,
yes.
On the other end, but not in the hospital. We would provide that device for you.
Oh, that's nice. That's very good. As a patient, I don't want to spend too much time in the hospital. Can you help me with that as a hospitalist?
Absolutely. Our goal as hospitalists, as physicians, is to get people better and get them home as soon as possible.
Right.
The thing that I say to my patients every time is, look, I want you to get home as soon as possible, but the key is as possible. I want you in as good a shape as possible when you go home so that you don't have to come back in worse shape. I want you to be happy and healthy when you leave.
Wonderful. That's great. That's a good attitude. Mm-hmm. That's a good a hospitalist. I love that. We're going to take a break. When we come back, we're going to talk about COVID-19 and how people can help keep themselves and their families safe. We'll be back on Health for Life.
If you're in need of medical care, don't delay. Your health won't wait. Hamilton Medical Center is ready to care for you. We are following CDC guidelines. Patients and guests are screened for COVID-19 symptoms. Those who are suspected to have the virus are treated in a separate area. Plus, Hamilton's high-powered UV light robots eliminate 99.9% of bacteria and viruses on surfaces. Please do not delay medical care. Your health won't wait. As always, Hamilton is here for you. Join us on a journey to better health. Health for life. Simply put, that is why Hamilton Medical Center is here. From primary care and specialty care practices near you, an accredited chest pain center, a certified joint replacement program, a new children's institute, cancer institute, endoscopy center, and more. Hamilton is here for you and your family. Learn more at hamiltonhealth.com. Hamilton Healthcare System. Health for life.
Welcome back to Health for Life. Today talking with Dr. Aubrey Cawthon, Hamilton Medical Center hospitalist. Glad you're here, Dr. Cawthon. I want to talk about COVID-19. Well, I don't really want to because we talk about COVID-19. I'm about tired. And I know you are about tired of
Absolutely.
COVID-19, but it's very important that our listeners understand some of the things that are going on with COVID-19. What are some of the safety recommendations that you have during this COVID-19 time?
A lot of them are common sense things that you've been hearing since February. Wash your hands with soap and water, or use a hand sanitizer that contains at least 60% ethyl alcohol. Cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Throw your tissues in the trash. Clean and disinfect frequently touched surfaces daily, including tables, doorknobs, countertops, desks, phones, and keyboards. Wear a cloth face mask in public. Don't touch your eyes, nose, and mouth with unwashed hands. This one may seem a little less obvious. The reason being, with coronavirus specifically, the receptors on our cells in those areas, eyes, nose, and mouth, can allow coronavirus to get into the body. The eyes doesn't seem to make sense, but those receptors, that the spike proteins that you may have heard of on the news, can enter that way. So that's why it's important to
on your face.
Correct. On your eyes, nose,
and mouth.
Correct.
It is so hard not to touch your face.
It absolutely is.
And and I never really had thought about it. But I talk with doctors all the time for this show, and it's don't touch your face. And then I spent some time trying to not touch my face, and it's so hard not to.
Yeah, the more you think about it, the more you need to.
That's right. Yeah, that's like when you blink. Trying to think about blinking. Now you're blinking all the time. But it's so hard not to touch your face. You got to, scratch your face or, something like that. So it's tough.
That's why we repeat it so often, to make sure it's kind of in the top of your head and say, oh, don't do that. Wash your hands first.
Well, speaking of washing your hands, is washing your hands better than using the alcohol?
For coronavirus, no, they're equal.
They're equal, okay.
The alcohol
will kill the virus.
Correct.
And washing your hands with soap and water will kill the virus.
Correct.
Okay. So they're both equal.
I recommend both.
Okay, got you. And it doesn't hurt to wash your hands and then use the alcohol.
It could dry your hands out, and you may need to use more lotion.
But other than that,
getting rid of the virus, absolutely.
Yes, good. That's very good. That virus, it is in the news. That's all we hear about is the Corona-19. What are some of the precautions that Hamilton Medical Center is taking to keep me and you safe?
Hamilton Healthcare System has put measures in place to help keep both staff and patients safe. When patients arrive, they're greeted by a staff member who takes their temperature and screens them for COVID-19 symptoms. We're following CDC guidelines and have put many processes in place to keep you safe, including face masks. Protective equipment is supplied to all team members. Social distancing guidance. We have reminders in the cafeteria. We have signs everywhere to keep it fresh on
stay
visitors.
6 feet apart.
Correct.
Wear that mask.
Correct.
Wash your hands.
Sanitizing stations throughout the facilities. Every time I see one, I'm sanitizing my hands.
Gotcha.
We have the UV robots that go into the rooms after patients leave to clean. It literally creates a bright flash of UV light that kills bacteria and viruses. Incredibly effective.
Now, I have seen that. That is something, how that works. It goes in there and just kind of flashes the room. That's part of that new technology we've been talking about today.
Correct. We also have staggered appointments to minimize the number of people in each area, and that's just a few of the things that we're doing.
That's very important. A lot of people are delaying medical care because they're afraid of the coronavirus. They're afraid of going to their physician. They're afraid of going to the hospital because of the coronavirus. How important is it not to delay medical care?
It's incredibly important. The sooner we catch things, the sooner we intervene, the better outcomes you have. When you let things go too long, it becomes much more deleterious to your overall health long term. Those same problems that people had before COVID, they still have. Getting in sooner means that we can do more and prevent worse outcomes.
I understand. So you still have to take care of those things that you need, even in this day of COVID.
Exactly.
Dr. Cawthon, I'm glad that you are a guest with us today. Thanks for sharing all this great information. If there's one thing that you can leave our listeners with, one word of advice before you leave, what would that be?
Well, not to be grim here around the holidays, but one thing that I feel as a physician, and I have my entire career, is an advance directive or a living will. Do you know what those are?
No, to be honest, I don't. The advance directive and the living will, is that the same thing?
Practically speaking, yes.
Okay. I know what a will is, and I have a will, But a living will, I'm not 100% sure. I
Liv-
think I know what that is, but I may not be correct.
Living will and advance directive are medical documents, basically. When you're in the hospital, it's much better to have all of that set out in stone, more or less, written down somewhere that you can reference if something becomes emergent. I don't like to put the pressure on families to make decisions when people are unable to make decisions themselves. So I think it's something that everybody should talk to their primary care provider about ahead of time. It's not something you want to be addressing in the hospital. But too often when I'm admitting someone, they say the same thing. I don't know what that is. I don't have one. I've got a will.
Right.
You know, my kids are getting all my stuff. Is that what you're talking about? No. We're talking about the things that can happen in life in general. It's more important to know what you want ahead of time. That's what we're talking about when we say advance directive or living will. Those documents also have other information like who's your power of attorney, medical power of attorney. My goal as a physician is always to do what the patient wants.
For more information about Hamilton Medical Center, call 706-272-6000, 706-272-6000, or visit hamiltonhealth.com.
If you're in need of medical care, don't delay. Your health won't wait. Hamilton Medical Center is ready to care for you. We are following CDC guidelines. Patients and guests are screened for COVID-19 symptoms. Those who are suspected to have the virus are treated in a separate area. Plus, Hamilton's high-powered UV light robots eliminate 99.9% of bacteria and viruses on surfaces. Please do not delay medical care. Your health won't wait. As always, Hamilton is here for you. Join us on a journey to better health. Health for life. Simply put, that is why Hamilton Medical Center is here. From primary care and specialty care practices near you, an accredited chest pain center, a certified joint replacement program, a new children's institute, cancer institute, endoscopy center, and more. Hamilton is here for you and your family. Learn more at hamiltonhealth.com. Hamilton Healthcare System. Health for life.
Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.